Hello, this is Kabir Southwick in beautiful Ojai, California, and this is a summary of the webinar which I just did called Understanding the Kapha Pathology. This is an explanation of understanding of, we could say, the development of Kapha in its early stages to the later expression of excess Kapha, which would be in a disease state. So excess Kapha in a disease state would be Kapha in the blood, which is high cholesterol, high triglycerides. Kapha in the whole circulatory system, which is going to contribute to high blood pressure. Kapha in the muscle tissue, which is going to contribute to growths and cysts and even tumors, fibroids. Kapha in the bones would be like a bone spur, excess hair growth on the body. Kapha in the nerves would contribute to depression. And of course, excess kapha in the fat tissue contributes to pre-diabetic condition, diabetes, and even, of course, obesity. So we don't want to just see ourselves as being a kapha person who wants to lose weight. Having excess kapha is very harmful, and there's many negative consequences from allowing the kapha to accumulate and spread and then form in different tissues and different systems in the body. So what we're going to talk about here is the first stage, or there's 6 stages in Ayurveda of the disease process in 6 stages. Only the 5th and 6th stage would really be diseases from the Western point of view. So the first 4 stages are its development. The early stage of excess kapha, or a little bit too much kapha, we call it the accumulation stage. So if you're a kapha person, you have to think back when you're young, before you were overweight and had too much kapha. But in the early days, and you can still probably feel it now, or anybody can feel too much kapha by the quality of too heavy and cold. When you have something that's heavy and cold, or you're eating heavy and foods, eating too much, eating leftover foods that's not warm, that's bland, heavy, then you're going to feel the same qualities, heavy. So the signs of the kapha kind of becoming a little bit too much, or we could say accumulating, and the home of kapha is in the stomach, and we could say to some degree the respiratory system. It's the actual lining in the stomach that protects the stomach mucosa from the acids in the stomach. So that is the kapha. It's necessary there. When you have too much kapha, then you lose appetite. And that's the first sign that you have excess kapha, is this lack of appetite. It's not hungry in the morning, not hungry till 2 o'clock in the afternoon type of state. Of course, it's easy to fast, and that's the antidote, is to fast for a couple days, and then the hunger comes back, and this fasting is the opposite of heavy. It's light. So, and then if you don't do anything about this heavy feeling, then, you know, and you have more oily food or fatty food as well, then the qualities of heavy, cold, and oily start to take effect. And then you could have oily skin, swelling, mucus in the body, and this lack of energy, and starting to feel some congestion. The next stage, or the 3rd stage of the development of the pathology of kapha, is the spreading stage. So now it's moving from its home in the stomach and moving to other parts of the body. So if you've got congested and upper respiratory congestion because you've had dairy, for example, which is thick, heavy, and cold milk, then that creates more kapha, and you get congestion, and you get this difficulty breathing and blocked respiratory tract. And this is the beginning of kapha reaching into the respiratory system. Even you start to get food allergies, swelling, edema, weight gain, nasal congestion. This is all signs that your kapha is spreading out of its home, so to speak, into the other tissue. And the 4th stage is when it's gone into other tissue. Now, of course, there's different tissue and different systems it could go into. We're going to touch upon some of those. The first would be the lymphatic system, because this is a a common area in which kapha goes. And here we would have already sinus congestion, but now we're going to get swelling in the lymphatic system. Maybe there's more kapha, more edema, more water retention, excess mucus. But once the lymphatic system is blocked, then you know, the toxicity level increases, the congestion level increases, and it's quite serious. And one of the best treatments is pre-panchakarma treatment of hot oil massage. For a kapha, it'd be let's see, a mustard oil, maybe mixed with a little sesame oil, hot over your whole body, leave it on for 30 minutes, and then steam it off. You could even take a hot shower. So if you did this every day, particularly if you had a massage where somebody was massaging your lymphatic system with hot mustard oil, and then you steamed it off, you did this for 2-3 days in a row, you would break up your congestion in your lymphatic system, and you reduce down the kapha that went into your lymphatic system. But the next place that kapha is most likely to go is into your blood and your liver. And what do we call kapha in the blood? Well, we can call it high cholesterol, high triglycerides, but in Ayurveda it's just kapha in the blood or fat in the blood. So you get signs in large liver and large spleen, varicose veins, particularly when there's clotting. These are signs that the kapha has entered the blood. Even a more pale complexion is an indicator. And if there's also kapha in the muscles, it's not often thought about, but you know, kapha in the muscles creates growths. So you know, this would fibroid, cysts, tumors. It could be ovarian cyst or skin cysts or tumors. Whether they're malignant or not is another question. But so if you have kapha in other areas, then you have to be concerned that you don't get kapha in the bones, because then you start to get growths and cysts. So this is a big danger of being a kapha person, is the risk of kapha in the muscles, which you're not thinking about. You're worried about your blood. Maybe you notice your respiratory congestion, but you're not thinking about your muscles. But this is a big concern. To know that you have too much kapha in the muscles, there are some signs. Excess earwax, if you're always cleaning out the ears. And the most common one is a dental tartar. And even, of course, for a woman, any type of lumps in the breast. These would be signs you have too much kapha in your muscles, and this needs to be addressed with herbs, breaking down the lymphatic system, and of course all these conditions will greatly improve by just following the kapha diet and kapha lifestyle recommendations, which we're not going to get into here. We're just understanding the path of kapha and the different tissues in which it can go into. The next one is, of course, the fat tissue, and the fat tissue is when we have too much kapha, which is very similar to fat. They're like, you know, brothers, fat tissue and kapha. I mean, so generally people have excess kapha, they have excess fat, but this generally also means gallstones, low libido, overweight. It's a pre-diabetic condition and leads to diabetes and obesity. So, and signs are a craving of sweets, slow metabolism, you know, no sweat, oily skin, low libido, and gallstone pressure. So these are signs that you have excess kapha in your fat tissue, even if you maybe are only 10 pounds overweight. So this can be a real danger and should be addressed. And that's really the purpose of Ayurveda, is not waiting for these doshic imbalances to be deeply ingrained in your tissue, but of preventing them. And that's what this whole series is about, is understanding the other areas in which kapha can develop and create more pathological diseases if it's not addressed in the early stages with just diet, lifestyle changes, and simple herbs. The more deeper, different tissue, some tissue is very difficult, like bones and muscles, going to take longer to remove than in the lymph or the blood, for example. So these are the deep tissues. The next is in the bones, and we don't think of kapha in our bones, but you know, early signs would be, you know, even just swelling in the joints, calcification, bone spurs, and you even have bone tumors. So, and hypothyroidism is in the same category, because it's related to the inner workings of the bone. A little beyond the scope of our talk here, but that is in the category of kapha in the bones. There's other factors as well. And then kapha in the nervous system is depression, basically. If you have vata in the nervous system, you have anxiety and nervousness and insomnia. If you have pitta in the nervous system, then you have irritability and anger and nerve pain or sciatica. But kapha in the nervous system, you're going to feel sleepy and heavy, and there's going to be more sleep and feelings of depression and wanting to sleep more. And cardiac is also in the same category of kapha in the nervous system. So, of course, kapha can be in the urinary system, and you can get kidney stones, kapha in the cardiovascular system, and you can have high blood pressure, blood clots, and gallstones, and in the reproductive system, you can get fibroids and urinary cysts and anemia and vaginal yeast and other imbalances that are related to excess kapha. So the point of this lesson is to see the importance of balancing your kapha in the early stages when you just start to feel heavy, you just start to feel lethargic, you just start to feel low appetite. It's very important to get the agni going. Remember we said one of the qualities of too much kapha is not besides heavy, stagnant, slimy, and dense, is cool and cold. So that puts out the appetite, puts out the digestive fire, and then when you eat, it doesn't digest completely. It becomes more, feels heavy. You feel sleepy after the meals, and this becomes more toxic, and it creates more congestion and creates more kapha, and then you're in a vicious cycle. So you really want to not just think in terms of, oh, I need to lose 10 pounds, but you need to reduce the kapha, and you need to understand where the kapha is in your body and where those imbalances are. And it's herbs that help address it in those individual different tissues. And the fifth and sixth stages of excess kapha are the pathological diseases, so something that you could be diagnosed with and treated for even medically. And at these late stages, it's much more difficult to address these deep kapha imbalances. So this lesson is to motivate you to take action early, to understand where your kapha is in your body, and to not just think in simple terms of losing weight. So I hope that helped you out. I hope that motivated you to stick to that kapha diet of, no fatty foods. Don't be doing coconut oil. Kaphas do very good with a vegetarian diet, high in beans, not eating heavy foods like bananas, not eating sweet fruits, and getting more exercise, having a light breakfast, 2 meals, no snacking. That's just quick. You need to watch my YouTube videos for more information. But all that is very important to avoid to have the kapha imbalances that we talked about today, where it reaches your tissue, particularly your deep tissue. Thank you very much, and I hope this helped you understand yourself and your kapha better. Thank you.